I'm going to really cherish this award because an award that's named for Lewis Blackman has really a lot of significance for me, and I'll tell you, it's because when somebody like Lewis dies in a hospital from mistakes, surrounded by really smart people and a lot of technology and a lot of caring people, it's stunning to me and frightening. And Mrs. Haskell has said that we need to hear the voices of the patient. But how would we possibly do that in an operating room? In the operating room, the patient's asleep. How do we hear their voices? And Dr. Gwandi gave us the way to do that. He said, let's take those 4 to 8 people that are closest to the patient and have them stop everything that they're doing and speak on behalf of the patient. Speak about the patient's concerns, speak about what they know most about that patient. And in that way, that they've become the voice of the patient. And we've seen that slowly develop across South Carolina, and we hear more and more and more voices being raised for the patient, and more patients' voices are being heard. Well, Dr. Gwandi, in his talk today from his team, told us that we've touched the lives of about 600,000 patients that are having surgery and high-risk procedures in the state. There's another 400,000 that we need to touch, and that will be the work of this next year and a half. What we're seeing is that by virtue of bringing all of the capability of the people in the room, that 4 to 8 people that surround that patient, every case, every day, we're beginning to influence the rate of complications. And we believe that we'll turn the corner on the number of people that are harmed as a result of surgery. So this next year will be a tough year, because getting to that final 400,000 patients is going to be hard won. But that's what Dr. Gwandi and the South Carolina Hospital Association is going to help us do.